So I tore my ACL snowboarding in New Year's Eve 2006, or New Year's Eve day. And I tore the ACL fully and partially tore my MCL. And I had it repaired, reconstructed 2 weeks later with a surgeon in Vail. And the surgeon used a whole very large screws and a whole extra screw than they should have, and drilled the tunnels wrong. And it wasn't healing properly, and about 4 months deep I was still having a hard time. And a year and a half later, after still not touching the snow, I stepped off of my skateboard. Didn't even have to run off, I just stepped lightly off my skateboard, and because my knee was never stable again, it buckled out laterally, and it broke the leg in 2 places of the tib, both down from the tibia plateau down to screws, and then also in the femoral condyle. And then it tore my ACL, my PCL, my PLC, and I'm questioning LCL. We don't know for sure. So I went and took a list of the top knee surgeons. I believe it's Becker's list of the top 20 knee surgeons in the country. And I just started knocking out everybody on that list that I could that was in California. I met 15 surgeons total, 3 in Hawaii, and then the other remaining in Colorado and in California. And I got, out of those 15 surgeons, I got 9 different diagnoses. I got doctors telling me to redo my PCL, ACL, doctors not knowing what to do, and such a broad spectrum. And I really, really had to hold firmly on what felt right to me, what felt right to my knee, and how much I really trusted these doctors. Because as much as I'm not willing to give up and need my life back, want to be able to snowboard again and skateboard and surf, I am not willing, I'm not going to just blindly follow into a doctor. And Dr. Stone was the next on that list, and I decided to go home to Colorado because I had family, and it was the easier setup. I go to Colorado, I meet with a surgeon there, I decide to do the surgery there. We plan on an ACL reconstruction, and the day before he says, we might need to redo your LCL, but I'm not sure. We won't know till we have you on the table. I go into surgery with him, and I wake up, and he said he redid my LCL, and he opened up my leg entirely, cut my T-band in half, moved a nerve, and wound up screwing into a nerve. So I wake up and I have so much pins and needles in my foot, I realize immediately something's wrong with my nerve. The doctor's like, you're fine, we had to move the nerve. Finally, after the 3rd month, I start going really crazy with how much pain I'm in, how much it's this screw in my nerve. I didn't even sleep for the first 4 months because my leg was just filled with pins and needles. And the doctor, who is on that top 20 surgeons list and is an amazing doctor, wouldn't even give me an MRI. And he said I was fine. It was just, we'll take out your screws, or this. And it was never dealt with. So then I decided to start my search again, and I started meeting with new surgeons again. And Dr. Stone, when I was in Hawaii, my physical therapist actually in Kauai had said, I've heard about this doctor in San Francisco, and he fixed my friend who's had 11 surgeries or something, and Dr. Stone gave him his 12th, and so it was finally the one, and repaired this guy fully. And he's the guy that fixes people. So I found Dr. Stone, and I came here, and everybody in the clinic has been amazing. And he really worked with me. I would not, we talked about doing an ACL, and I kept pursuing him, saying, I don't think it's just ACL, I think it's this. And him and the assistant surgeon and the therapist, we all worked for just highly dedicated for a good couple weeks, really trying to hammer out exactly what was going on with my knee. And nobody was giving me that time. Most surgeons that I'd go to would just watch me walk a couple times, and they'd look at my diagrams and my x-rays and my MRIs and then diagnose me, and that was it. And he spent hours with me and his physical therapist spent hours watching me and really tracking. I had 3 big screws that needed to come out, 2 from, one big one from the first surgery and 2 from the one in 2012, and he was not sure he'd be able to get one of them out, and it was the one that was sitting on the nerve. And I really felt like he could get it out, and I really felt like it would change my world. And he was like, we'll see, but if I take it out, your ACL might come out, and it could be a problem, and, you know, we'll do it during the next surgery. And I was like, no, man, I know it can come out. And I woke up from surgery, and Anne and Dr. Stone were just gleaming and so happy because he found this like miraculous way to get the screw out without pulling my ACL out. Showed me the nastiest pictures I've ever seen, but was so excited, and everybody in the whole office was like so happy for me that it came out, and my world started definitely changing from not having, you know, my nerve constantly fired by screw. And once he was in surgery with me removing the hardware, could really see, oh my God, you really need a new ACL, and you need a new posterior lateral corner. And to have someone with a level of confidence that feels, it's bona fide. It's not, you know, he does the work. He's able to, he was able to technically do things that are very, very complicated, and had no fear with entering into a scenario that most doctors wouldn't even want to touch anymore. And that is something that's extremely helpful for when you go to doctor and they're like, you're never going to be able to do this again. You're never, you know, and on and on. And I'm like, no, I'm not okay with that. I'm totally persistent. I want to be able to hike. I want to be able to run. I want my life back. 100%. And to find people who match my level of perseverance and then some, they're all supportive, and the physical therapists are outrageous. And one of my favorite things about this place is the PTs will sit there and watch me walk with cameras and sit there and study everything that I say. And then Dr. Stone has the utmost respect for them, and it's like this amazing marriage of different viewpoints that are collected, and they all work together. And it's much different because a lot of surgeons I've found seem to look at the body in a very two-dimensional, okay, this bone's here, this is here. But between the physical therapist and the assistant surgeon, they watch the anatomy function so much more. There's so much more time dedicated to figuring out exactly what is going on and how to heal it, how to mend it and bring somebody back. And I'm very excited for my next surgery. And that's the story.